Medicare is confusing. This video will help you understand what options you have for Medicare coverage and how to figure out which coverage is right for you. So Medicare Part A is inpatient insurance, Medicare Part B is outpatient insurance, Medicare Part C is Medicare Advantage, and Medicare Part D is Medicare prescription drug coverage. Virtually no one has just Medicare Parts A and B for a very good reason. This is one of the main takeaways of this video. Medicare Parts A and B have no maximum out-of-pocket spending limits. This is a huge financial risk. For example, with Medicare Part B, which is outpatient coverage, after you pay the annual deductible, this year it's $257, you are responsible for 20% of all of the rest of your outpatient medical costs for the year, with no limit. It doesn't matter if that 20% adds up to tens or hundreds of thousands of dollars. If you have no other coverage beyond Medicare Parts A and B, you are responsible to pay all of those charges. Because of this financial risk, almost every Medicare beneficiary enrolls in coverage beyond original Medicare. Most people have two major options for Medicare coverage. Original Medicare Parts A and B, a Medicare Supplement, also known as a Medigap plan, a standalone Medicare Part D prescription drug plan, and possibly another policy for dental, vision, and hearing coverage. Or a Medicare Advantage plan that combines the benefits of Medicare Parts A, B, and D. How do you choose Medicare coverage? There is no one-size-fits-all, absolute best for everyone Medicare plan. Each person has unique medical and financial considerations. The right choice for you might not be the right choice for your friends, family members, or even your spouse. That's okay. There are plenty of Medicare coverage options available, so you can be sure that you can find the right coverage for you. Also, no Medicare plans are free. You will pay for your healthcare in different ways depending on your plan choice, but no Medicare options are free. First, no matter what coverage you choose, you will have to enroll in Medicare Parts A and B. Medicare Part A has no premium cost for most people. This is the part of Medicare that's been prepaid by your FICA taxes all the years that you've been working. Medicare Part B does have a monthly premium cost. In 2025, most people pay $185 per month for Medicare Part B. However, this is income dependent. High-income individuals may pay more than the standard premium, and folks with very low income may pay less. Be sure to include your Medicare Part B premium in any estimate of healthcare expenses. Here's the big difference in how you pay for healthcare with a Medicare Supplement and standalone Part D plan versus a Medicare Advantage plan. With a Medicare Supplement and Part D plan, you will have monthly premiums that you have to pay to insurance companies, but you will have low out-of-pocket expenses when you receive medical care. Medicare Advantage plans are pay-as-you-go, usually with low or no monthly premiums to be enrolled in the plan, but co-pays and coinsurance amounts up to an annual maximum limit every time you receive medical care. If you choose a Medicare Supplement and standalone Part D plan, you will have additional monthly premiums that you pay to the insurance companies to remain enrolled in those plans. For a more comprehensive Medicare Supplement or Medigap plan, those premiums can start around $100 a month to well over $400 a month. The prices vary quite a bit depending on your age and where you live. You can expect your Medicare Supplement price to increase once per year. You pay these premium costs and have increases whether you use your insurance or not. The trade-off for paying those higher premium costs is that when you go to the doctor or hospital, you will have very low or no out-of-pocket costs for the medical treatment that you receive. For example, if you purchase a Medicare Supplement Plan G, your out-of-pocket costs for medical treatment covered by Medicare Parts A and B is capped at $257, which is the Medicare Part B annual deductible this year. Medicare Advantage plans are the opposite. Medicare Advantage plans may charge a monthly premium to be enrolled in the plan, but many don't. They are able to keep the monthly fees generally lower than Medicare supplements or even at zero because Medicare pays a contracted amount each month to the Medicare Advantage company to pay for and manage the health care of each of their enrollees. The insurance company is now taking on the risk of paying for that person's health care, and Medicare itself won't pay anything directly for that person's health care claims. You pay your Medicare Part B premium, then Medicare sends that amount plus more to your Medicare Advantage company to pay for and manage your health care. With a Medicare Advantage plan, if you need to go to a doctor or be in a hospital or receive any kind of medical treatment, that is when you pay. There are set deductibles, co-pays, and coinsurance amounts that you pay when you receive care during the calendar year. Every Medicare Advantage plan has an out-of-pocket maximum spending limit to protect enrollees' finances. If you hit that limit with your spending on covered medical expenses, then the insurance company will pay all of your covered medical costs for the rest of the year. In 2025, the maximum out-of-pocket spending risk is allowed to be as high as $9,350. In most of the country, there are Medicare Advantage plans with far lower maximum out-of-pocket risks. The nationwide average this year for in-network maximum out-of-pocket risk is $5,800. Medicare Advantage plans are set up similarly to the types of insurance that you are most used to, whether that is a group employer health plan or an Affordable Care Act plan. It's one insurance policy for all of your health care with a managed care design that anyone who has been in a PPO or an HMO will be familiar with. Going with original Medicare, a Medicare Supplement, plus a standalone Part D plan and dental and vision insurance policy is a different structure from something like your group employer plan or an ACA plan because it's not combined into one policy. You will have different policies and ID cards for different parts of your health insurance. You will need to carry your Medicare card, Medicare Supplement card, Medicare Part D card, and dental and vision card to show at the appropriate offices. With Medicare, drug costs are handled separately from medical costs. When it comes to drug coverage, you will pay a copay or coinsurance amount each time you pick up a prescription, whether you have your Part D coverage through a standalone Part D plan or if it's included in your Medicare Advantage plan. And you may have to reach an annual deductible before being eligible for lower copay or coinsurance amounts. With a Medicare Supplement and standalone Part D plan, you have more predictable monthly costs and lower out-of-pocket risks beyond those monthly premiums. With Medicare Advantage, you may have low or possibly no monthly premium costs and generally higher out-of-pocket risks if you do need medical treatment. Let's look at coverage differences. Will I have original Medicare coverage? Whether you choose a Medicare Supplement or a Medicare Advantage plan, you will have full original Medicare Parts A and B coverage by law. If you have a Medicare Supplement, original Medicare is your primary insurance, and the Medicare Supplement will pay some of the co-pays, deductibles, and coinsurance amounts that would otherwise be your responsibility if all you had was Medicare Parts A and B. Medicare Advantage plans are required to cover at least as much as original Medicare, and that standard is checked every single year before the plans are able to be offered to the public. Almost all Medicare Advantage plans offer coverage beyond what you would receive with just original Medicare Parts A and B. If you choose a Medicare Advantage plan, that plan is your primary health insurance coverage rather than original Medicare. Are there medical provider networks? With a standard Medicare Supplement, there are no provider networks. You can see any doctor and go to any hospital that accepts Medicare and is accepting Medicare patients. The one exception to this is Medicare Select Medicare Supplements, which do have networks. They are rare, but if you are considering a Medicare Select Medicare Supplement, make sure that you understand the network limitations before you enroll. Medicare Advantage plans have provider networks. Some Medicare Advantage plans will only cover your care if you see an in-network provider. Those are HMO plans. Other plans will cover medical care received from out-of-network providers, usually at a higher cost to you. Those are PPOs. It's very important to make sure all of your doctors are in your plan's network before enrolling so you don't get unexpected bills later. All Medicare Advantage plans must have worldwide emergency coverage. If you are traveling outside your plan's network and have a medical emergency, your plan must provide coverage at in-network rates. Will I need referrals or have to go through prior authorization? With Original Medicare and a Medicare Supplement, it is very rare that someone would have to go through prior authorization. However, it can happen for procedures that could be medically necessary or elective. For the vast majority of medically necessary treatments, Original Medicare has no prior authorization and does not require referrals. Medicare Advantage plans may require referrals to see specialists. That's far more common in HMOs than in PPOs. Many procedures require prior authorization if you have a Medicare Advantage plan. Although prior authorization gets a lot of play in the news, it's really pretty unusual for a prior authorization request to be declined. And when a request for prior authorization is declined more than 80% of the time, if your doctor appeals that decision, it does get reversed on appeal. We help all of our clients if they run into any problems with prior authorization, and almost all of the time, the issue can be resolved quickly and in favor of the client. Is coverage the same from one plan to another? Medicare Supplement coverage is standardized by law. This chart shows the standard Medicare supplements offered in 47 states. Wisconsin, Minnesota, and Massachusetts have different Medigap plan designs. If you want, for example, a Plan G, every company selling Plan G in your state will have exactly the benefits listed here. However, monthly premium costs are very different from one company to another, so it is important to comparison shop. Medicare Advantage plan coverage is not standardized, so it is important to look at each individual plan to see if it's a good fit for you before enrolling. Are there plans that offer extra coverage? Original Medicare does not cover routine dental, vision, or hearing care. Medicare supplements are only allowed to fill the gaps in Original Medicare. So Medicare supplements do not offer extra coverage like dental, vision, hearing, transportation, fitness, and other benefits. Some Medicare supplements come with discount programs for some of these extra benefits, and that might be enough for you. If you do need more coverage, you can look at standalone dental plans or combination dental and vision or dental vision hearing plans for extra coverage. These standalone plans do also have monthly premium costs. Many Medicare Advantage plans offer extra benefits. These are not the same across all Medicare Advantage plans, so if they are important to you, make sure you compare these benefits among the different plans before enrolling. One thing to be aware of, often the very rich benefits that you see advertised for Medicare Advantage plans are not available to most Medicare beneficiaries. Those tend to be limited to people who are eligible for both Medicare and Medicaid. What happens when you receive medical treatment? With a Medicare supplement, your provider submits a claim for medical services to Medicare itself. Medicare determines if the claim is covered, and if it is, Medicare will pay its part and then send it on to your Medicare Supplement company, which will pay its part. Medicare Supplement companies cannot argue with claim decisions made by Medicare. This means you'll never have to fight with your Medicare Supplement company about a claim. All those decisions are made by Medicare. This also means that if Medicare denies a claim for medical services, your Medicare supplement is not allowed to pay anything toward that claim. Medicare Advantage claims are determined by the Medicare Advantage insurance company. All of these plans have to include coverage that is at least as good as Original Medicare, but the costs are not identical to Original Medicare Parts A and B. It is important to look at each plan's deductibles, co-pays, co-insurance, and out-of-pocket maximum risk, and know what the process is for disputing a claim before you enroll. When you're looking at a Medicare Advantage plan's summary of benefits, Pay close attention to the medical deductible and the maximum out-of-pocket risk. Many of us coming from high deductible health plans through our employer are used to seeing a very high number in that deductible spot. That is generally not the case with Medicare Advantage plans. Many Medicare Advantage plans have $0 medical deductibles. That means you don't have to pay a large amount of money out of pocket before the insurance company kicks in and starts paying. If your plan has a $0 medical deductible, your costs for medical services will be the copays or coinsurance amounts shown in the summary of benefits and evidence of coverage. These copay and coinsurance amounts are tracked throughout the year, and if you do meet the out-of-pocket maximum risk for the year, then you are done for the rest of the year paying for covered medical expenses. With most Medicare Advantage plans, it's very difficult to meet the maximum out-of-pocket risk. Only 3 to 5% of Medicare Advantage enrollees meet the out-of-pocket max in a calendar year. Even though the risk is small, it's a good idea to do the math and figure out what the worst-case scenario for you could be before you enroll in any plan. Estimated costs. Let's go through some estimated costs to see what either option would cost you in both a month and calendar year. What you have available in your zip code may be different. I am using 2025 averages for this comparison. Most people pay $0 for Medicare Part A and $185 per month for Medicare Part B. In this example, we're going to use Medicare Supplement Plan G, which has a nationwide average cost of $164 per month. Medicare Part D has a nationwide average monthly premium cost of $46.50, and dental and vision insurance has an average monthly cost of $45. Again, these are nationwide averages. Your costs may be lower or higher depending on where you live. If we add all of these together, we have a monthly premium cost of $440.50 per month. Your out-of-pocket risk is the Medicare Part B annual deductible of $257, plus drug copays and any dental and vision copays. Your total cost for the year would be $5,543, plus drug copays and potential dental and vision copays. Those drug copays are capped this year at no more than $2,000 out of pocket for covered Part D medications. If you take medications that are not covered by Medicare Part D, you will have to pay for those outside of your Part D plan, and they do not count toward the $2,000 maximum spending cap. If you have a great year, you don't go to the doctor for anything except preventive care, you have no medications, and you only have preventive dental and vision care, your cost will be $5,286, just the monthly premium costs to be in all of your insurance plans. If you have a terrible year with lots of doctor office visits, inpatient hospital stays, and expensive medications, your cost will be $5,543, plus drug copays of not more than $2,000 for covered medications, and dental and vision copays and coinsurance. In this worst case scenario, we're looking at a total of $7,543 plus dental and vision copays and coinsurance. On the other side, we have $0 for Medicare Part A, $185 for Medicare Part B, and we'll take the average Medicare Advantage monthly premium, which this year is $17. There are Medicare Advantage plans that have $0 monthly premiums and some that are over $200 per month. This premium amount is going to depend heavily on where you live, which plan has your doctors in network, and which plan has a design that is going to work well for you. Per month in this estimate, you will be paying $202 in premiums. That annual premium cost will be $2,424. To find your out-of-pocket risk, you have to add the monthly premium to the out-of-pocket maximum risk for both the medical part of your coverage and the drug coverage. Just like in the standalone Part D plan example, costs for covered medications are capped at $2,000. On the health side, the government has limited Medicare Advantage to no more than $9,350 for an in-network maximum out-of-pocket risk. There are many plans with far lower maximum out-of-pocket risks. The nationwide average, which we'll use here, is around $5,800. If you have a good year with few to no medications or office visits, your cost will be just the premiums of $2,424. The worst case scenario would be that premium cost plus the $2,000 drug cost plus the average health out-of-pocket maximum, which is $5,800. That gives us a total of $10,224. As mentioned earlier, it is tough to reach a Medicare Advantage plan's out-of-pocket maximum limit. Only 3 to 5% of enrollees ever do. However, it is always best to know going in what the absolute worst case scenario could look like. Can I change coverage later? Medicare Advantage plans change every year. Everyone has an opportunity to switch plans during the annual enrollment period between October 15th and December 7th. This is the time of year when you have the most options open to you. People who have a Medicare Advantage plan can also switch to a different Medicare Advantage plan during the Medicare Advantage open enrollment period every year between January 1st and March 31st. You may also have special enrollment periods available to you throughout the rest of the year, depending on where you live. You will also have the opportunity to change your coverage if you move out of your plan's service area. Keep in mind that if you change Medicare Advantage plans mid-year, the deductible and tracking on everything you spend toward the out-of-pocket maximum limit starts over. In most states, once you are beyond your first 6 months on Medicare Part B, you will have to answer health questions and be approved to buy a new Medicare Supplement policy. And depending on your health and your state laws, it might not be possible for you to switch your Medicare Supplement. If you have a Medicare Supplement and decide that you want to switch to a Medicare Advantage plan, that is very easy. You just have to wait for the annual enrollment period, October 15th through December 7th, and enroll in a Medicare Advantage plan at that time. If you want to move in the other direction from a Medicare Advantage plan to a Medicare Supplement, same rules apply. If you've been on Medicare Part B for more than 6 months, you probably are going to have to answer health questions and go through medical underwriting to qualify. The exception to that is if you've only been in your Medicare Advantage plan for 12 months or less. In that case, you have what's called a trial right, which is a guaranteed issue right to purchase a Medicare Supplement regardless of your health conditions. Which type of coverage works better? It's really up to each individual. There is one limitation that should be noted. If you are eligible for both Medicare and Medicaid, you cannot purchase a Medicare Supplement policy unless you give up your Medicaid benefits. People who are dual eligible for Medicare and Medicaid can enroll in a Medicare Advantage plan, whether one specifically designed for people who are dual eligible or just a regular Medicare Advantage plan. If you have a serious chronic health condition that requires a lot of medical care, a Medicare Supplement is likely to work better for you. For most people, though, the choice is really up to you. If you prefer predictable monthly costs with very low out-of-pocket expenses when you receive medical care, take a look at Medicare Supplements. If you'd rather have low or possibly no monthly plan costs and pay for medical care as you receive it, then take a look at Medicare Advantage plans available in your zip code. Once you've narrowed your choice to one type of coverage or the other, there are still plenty of options open to you for either Medicare Supplement or Medicare Advantage coverage. This is when you get down to comparing specific plans from specific companies. For that, you will need tools like Medicare.gov, your state Department of Insurance website, insurance company websites, Medicare publications, and insurance company documents. This research can be time-consuming, frustrating, and confusing. And there's absolutely no benefit to doing this research on your own. Medicare plan costs are the same whether you do your own research and enroll directly with an insurance company or you work with a Medicare plan broker who does all the research for you and can help you comparison shop all the different plans available in your zip code. This is what we do for our clients. We work with many different insurance companies and can impartially comparison shop with you to find the company and the plan that's the best fit for your situation. We do this completely free of charge for our clients. We're able to do that because for every enrollment in a Medicare plan through our office, we are paid a commission by an insurance company. The commissions are very similar across different insurance companies and different plans, so we have no incentive to push anyone toward one particular company or one particular plan. We are free to find the coverage that best fits each client's needs. Once you are a client, you have ongoing free access to help whenever you have a question or when rates change or the Medicare annual enrollment period rolls around again. What to do if you will keep working past age 65. If you don't plan to retire and leave your group employer health plan until after age 65, you still have a few things to do in the months before you turn 65 regarding Medicare. First, ask if your employer insurance is creditable coverage. Creditable coverage means that your insurance plan is officially as good as or better than Medicare. If your insurance is creditable coverage, you can safely delay enrolling in Medicare until you are ready to retire without worrying about late enrollment penalties. If your employer coverage is not creditable coverage, you should enroll in Medicare Parts A, B, and D at age 65 to avoid late enrollment penalties later. If you have good employer health insurance with low out-of-pocket costs and risks, and it's creditable coverage, you can stay on it and delay Medicare as long as you are employed and still qualify for that group coverage. If your insurance at work is expensive and has high out-of-pocket costs, you may be better off switching to Medicare at age 65. Here are some things to consider. Monthly premium cost. Does your spouse or any dependent need your employer coverage? Deductibles, out-of-pocket maximum risks, and medication costs. Compare those from your work insurance to Medicare coverage available in your area to figure out whether it would be better for you to stay with your group plan or move to Medicare at age 65. If you have Medicare questions, please feel free to give the office a call at 877-312-1414. You can also reserve a free, no-obligation Medicare plan consultation using the link in the description. We're here to help you understand your options and help find the right Medicare coverage for you. Have a great day.